You might get a little like permission pop up that I'm recording. All right, so we are going to get started. Thank you guys again for joining us today for our parent group training on understanding challenging behavior. Okay, so hopefully you can see my slides okay. We are going to go through a number of items today. We're going to do a little icebreaker activity. We're going to do a review about what is positive behavior support. We're going to talk about perspective taking, the ABCs of challenging behavior, understanding function, and then we will have time for questions. So one thing I really like to do is to focus on the positive. It's very hard to get wrapped up in what is not going right instead of focusing on what actually is going right. So let's start there. I'm sorry, I'm trying to make myself be able to see everything with this funky view that I'm in. Okay, so the question is, trying to see the question. Here we go. What is something that you did with your child this past week that you feel proud about? So you can either put it in the chat or unmute, but think about this past week or maybe the past month. And think about something that you did with your child, something that maybe that they did that you want to share. I'm gonna give you guys a minute. I'm gonna also think as well. Oh, I will give you a little insight into my family as well in a minute. I think I have a picture on the next screen, but I also have two young kids. So I like to also share when I can within the trainings. So I'm going to find the positive in a difficult situation. So my daughter is 5. She started kindergarten this year. She is neurotypical. However, she has her hosts of challenging behavior. So yesterday, when I was not home, decided to cut her bangs. So I know we've all heard of this, kids getting a hold of scissors and cutting their hair. She had never done it before, but she did. And I am proud that I held some restraint when I came home and had to like address her in this situation. She did have um some things taken away. Like she had her iPad taken away and things of that nature. But the positive was that I felt like the way that I responded to her was regulated. Like I was more calm in my approach. And I think that's really important. So we talked about it and we talked about next time there'll be a bigger consequence and why it's unsafe to do that. So I am proud about that. Even though I'm not proud of her behavior, I am proud of my response to her behavior. um, does anyone else want to share? I'll check the chat. Um, or you can unmute about something this past week or month that you feel proud about. If you're not comfortable sharing, also just think about it. Think about something positive, a positive interaction, an activity, something that you did with your child that you are proud of.
I could share something about Hassan.
Go ahead.
Um, so the last 2 weeks he been waking up dry, and I'm trying to work with him on his party train. And he been doing good. So the last couple of days he wake up dry. So I put him in the toilet and he goes on. So that's something I'm really proud of him. But it's also, it gave me a hard time because I try to, when he comes home, take the pull-ups off, put the underwear on, and just let him know, like, if you're gonna pee, I'll point out towards the bathroom. But, the first day I put it on, I had to deal with a couple incident and it wasn't fun. So, but other than that, they really good kids. I don't have anything like crazy yet with that scissor kind of, or the matches or the electric wires. I've been there, I've done it myself. But other than that, yeah, that's all. You've been doing great as well with the toilet. So yeah, I just wanted to share that with everybody and thank you.
Yeah, that's great. Thank you for sharing. That's definitely something to be proud of. Potty training is a big hurdle and it can be frustrating on the parents' part, right? Especially when they're having accidents. We'll do one of these groups on potty training more towards the spring. And we'll
Okay.
chat more about it. But yeah, that's great.
Yes, that's awesome. I'm using the same schedule I did with Gio, so but Hassan is always takes. He's a little behind when on like advanced, like he's not as advanced as Gio,
Mhm.
but he's catching up. He's doing good. So
That's
I
great.
just wanted to share that. Thank you, everybody.
Yeah, thanks for sharing.
Yeah, you're welcome. No problem.
All right, we're gonna move on. If I can get my screen to work. I'm telling you. I'm sorry, guys. My Zoom is doing some weird stuff today. Exit full screen and see if this works. There we go. Okay. There's a picture of my children. This reminded me today when I was going through this that I don't have Christmas pictures for this year. We didn't even think about it. This probably, I want to say 2 years ago, maybe 3 years ago. So Gabby is my daughter. She's right there. She is now 5, and that's my son Joey. He's now 10, and that's my dog Noah. She's now 3. She was a puppy in this picture. So it was the first year we did pictures with her in them. So that is us. Besides being a director and a behavior analyst, I'm also a mom. So I do share those experiences throughout our trainings as well. So our ground rules is a safe space to share thoughts, ideas, and experiences. I want everyone to have the opportunity to share who wants to, and this is a judgment-free zone. No parent is perfect, and if they tell you they're lying. We're just doing the best we can, and we're here just to share some strategies and support one another. So, PBIS, if you weren't at our first parent group training, we did an introduction to PBIS, which is just stands for Positive Behavior Interventions and Supports. You can go back and watch. I think I link in the resources. I'll send you the slides following the training today. And in the resources slide, in the last one of the last ones, has a link to one of the first trainings. So if you can go back and watch that if you'd like, it's all about like what exactly is PBIS. Oh, look, here's a little snapshot. So we do have expectations at school that are positive, be safe, be kind, have fun. They're kind of like our values in the program. We use common positive language, right? We want to really be clear with what we want kids to do, not what they shouldn't do, right? So focusing on that positive. Some of that common language includes things like use your walking feet, keep a quiet voice, hands to yourself, focusing on giving those clear rules and expectations, teaching them, right? What to do and what are the expectations at school. We use a lot of visual supports and schedules. We have a focus on social emotional skills and development, and we utilize positive reinforcements and rewards for appropriate behaviors. So, we're here today to talk about understanding challenging behavior. So, we are going to start a little bit with perspective taking because I think that's really important. So, I'm going to read a little scenario and we're going to talk about it. So here's a scenario. Angelo's playing with his blocks while mom cooks dinner. Mom says, Angelo, dinner is ready. Come to the table. And Angelo comes to the table. After a few minutes, gets up, takes his sandwich, and goes back over to play with his blocks. Mom says, Angelo, come back to the table. Angelo comes back to the table, drinks some juice, leaves again. Mom tells Angelo again to come back to the table and starts to guide him back. So mom must have got up to bring him back. Angelo throws his sandwich, falls on the ground, kicking and screaming. So, two questions here. How do we think mom feels in this scenario? You can replace dad in there, grandma, grandpa, whoever is the caretaker. How does the parent feel on this scenario? Again, you can put it in the chat. You can unmute. Let's see. Upset. Yeah, right? Like it, I know from experience, like coming home and cooking and getting everything ready to eat, even if it's sandwiches, whatever it might be, especially after working, and then the child doesn't want to come to eat, it can be upsetting, it can be frustrating, right? Um, all right. Second question. How do we think, oh, sorry, Angelo feels? We're taking perspective here. We want to make sure that we're looking at all sides, all angles. How does Angelo feel? You can put it in the chat or on mute. Yeah, same, frustrated, right? So kids can feel all of the same feelings that adults do, right? So in this scenario, when mom or dad is upset, frustrated, so is the kid, right? Like from his perspective, he just wants to play, right? He doesn't want to sit at the table. Um, so there is definitely frustration on both ends most of the time when a kid is having some challenging behavior. We'll come back to Angelo. We're going to delve in a little bit to talk a little bit more about behavior. So ultimately, behavior is communication, right? A lot of the kids in our Easterseals programs have some sort of communication delays. Some have vocal language, some don't. But even neurotypical 3 to 5 year olds are still developing their language, right? They don't have that full realm of expressiveness that adults do, right? So a lot of the times they use behavior to communicate their needs. Okay. So it could be that they want something. It could be that they're sad or they need help. They could be feeling that frustration. Um, they might not want to do something, or they might be scared or feeling any other type of like overwhelming or overstimulated feeling. And if you think back to infants, right? Infants use their cries, right, as communication. And as kids grow and develop, we expect their communication skills to kind of keep up. And sometimes when they don't, they still have those learned ways of communicating their wants and needs to their caretakers. So we just talked about this. Behavior definitely communicates a message when kids don't have the language to do so. And behavior can be used instead of language by a child who has limited social skills um, that have learned that the challenging behavior will result in meeting their needs. So that's an interesting one. So even if a kid does have some language, right? Um, they still might not have the social skills to be able to fully express what they need in that moment, right? So if their behaviors have gotten them access the things they want in the past, they're going to use behavior instead of language, right? And I think the next slide is that they use it because it works, right? If a child gets access to what they want, following a challenging behavior, they're going to keep engaging in that behavior, right? I added some slides here that are newer, so you'll see like the difference between some of the slide formatting. Um, like I said, I'll link all the resources at the end of this presentation, but a lot of this content is from the National Center for Pyramid Model Innovations. And they revamped a lot of their training materials, I want to say like 2 years ago, and they embedded a layer of trauma-informed practices. So I like to include these slides as well when we're talking about challenging behavior in young children, because sometimes things in the environment, the current environment, trigger the same response a child had to a traumatic event, right? So here's an example. Let's say that trying to think. Let's say that a child had a bad experience at a doctor's office. Many kids do. It's a scary place sometimes, right? So maybe they had, and maybe it was just shots. Maybe they had to be held down to get a shot or a vaccination, right? Maybe they had a surgery, right? I don't know. Imagine a traumatic event, right? That happens at a doctor's office or a hospital, right? Then, right? the child has to go back to that same environment. The child goes back to the doctor's office, right? Their body's response to the environment is gonna be to feel those feelings that they felt when that traumatic event was happening, right? So just walking into that environment could trigger that response. And that's essentially what we call like a trauma response. And it could look like a number of things, including challenging behavior. It could be they run away, could be they're hitting, tantruming, could be some hyperactivity, hypervigilance, or even the opposite. It could be some withdrawal where they just like shut down. So we always have to be aware that trauma plays a role in behavior and just have that understanding so that we can be sympathetic and compassionate in those moments, um, knowing that they could stem from a traumatic experience. So, what can you do? So, some of these topics we've talked about in our intro training. We'll talk about some more of the topics today and some more of them in the next few upcoming trainings. But pyramid model practices include how to build responsive relationships. We talked about this a lot in our first training, right? How to focus on the positive, how to call out the positive behaviors, how to use the 5-to-1 ratio of positive to negative interactions. Um, to really be responsive and engage with your young children. Um, Create supportive environments. It's really important that kids can feel safe. So we try to do that at school, and you guys should try to do it at home as well. Try to keep the home environment one that is safe, that is supportive, that is predictable. And we know that home environments can change, right? So as much as we can talk to our kids and teach them when there are unexpected events or changes happening, the more that we can do that to create that safe environment, the better. We also want to teach social skills and support social emotional competencies. We're going to have a whole training on that coming up in a few months as well. And we also just want to consider trauma, like I said, when interacting with a child. We always want to interact with kids in ways that feel safe, comfortable, and supported. We want to validate their emotions and provide support for them to express them. So this is an interesting strategy because sometimes kids engage in behavior as a result of setting an expectation. Like think about Angela, right? Like mom was like, nope, we're gonna eat at the table, right? So as a result of setting that expectation, the child had a challenging behavior, right? Um, it doesn't mean we can't still validate an emotion and hold the expectation, right? So we can say, oh, Angela, I see like that you're really upset. I'm sorry about that, but we're gonna have dinner at the table. So you can do both, right? Um, and then if our actions are the ones that are triggering some of that, we want to make sure that we can modify our own actions. As a behavior analyst, it took a while to understand that the only behavior you can actually control is your own, right? So we are responsible for our own behavior. So that's what we can modify. And when we modify our behavior as parents, it does directly impact our child's behavior. So we're going to talk a little bit about the ABCs of challenging behavior. Now, this is a model that behavior analysts use to look at behavior in the context of what's happening around it, right? To try to understand it a little bit more. So the A stands for antecedent. So we always want to look at what's happening before the behavior occurs, okay? The B is for the behavior. Now, really, a behavior is anything that a child does or that anybody does. So, me speaking, moving my hands as I talk, that's all the behavior. We try to say challenging behavior when we're talking about a behavior that is maybe unexpected. And then C is consequence. So it's what comes after the behavior, and it's not necessarily a punishment. We're going to talk about reinforcement, and that is actually a positive, right? That comes after the behavior, right? So It's just the C is just whatever happens after. So we're gonna look at all three parts when we're looking at one behavior specifically. So we're going to look at Angelo. I kind of modified this a little bit, and we're going to pick out the antecedent, the behavior, and the consequence. So I'm going to reread this. It's kind of simplified. Angelo's mother tells him it's time for dinner. She guides him to sit in the chair. He throws his sandwich, falls on the floor, begins kicking and screaming, and shouts, "No." Mom tells him to stop, tries to pick him up, and he kicks her, and she sends him to his room. Okay. So it's a little more what happens at the end. So what is the antecedent? What comes before the behavior here? You guys can put it in the chat or unmute. What is coming before? Any ideas what the antecedent would be? All right, so the before here is literally just that she sets the expectation. She tells him it's time for dinner, and then right before he has that last episode, she kind of guides him back to the table. Right. So this is like the beginning part where she already kind of asked him a few times. He came back, he left, he came back again. So the before the antecedent here would be mom said it's time for dinner and guides him back to sit in his chair. There it is. And now the behavior itself here um is pretty self-explanatory. There's a couple parts to it, right? So, right, he throws a sandwich, falls on the floor, kicks and screams and shouts, "No." Okay. Um, there is like another kicking at the bottom. Um, but we're we could we're not going to worry about that right now because we're just going to look at this one incident. Okay, this essentially is like a chain of behaviors, right? So we're gonna look at this part. Throws a sandwich, falls on the floor, kicking and screaming, shouting no, kind of whole tantrum scenario. So that's the behavior. Now, the consequence, what did his mom do? Ultimately, she tells him to stop, picks him up, and then he gets sent to his room. Okay. So three parts there. Annie's seen it, mom set the expectation, guides him to the chair, behavior, tantrum. Three, mom tells him to stop, tries to pick him up. Ultimately, he goes to his room. Okay. I had two slides there. Interesting. So we're now going to talk a little bit about the functions of behavior, and we're going to come back to Angelo. You can think about kind of that breakdown, that ABC analysis of the behavior, and think about if it would fit in one of these categories when we talk about the functions of behavior. Now, there are four major functions that we're going to talk about: escape, attention, tangible, and the sensory. So that's like a little way to remind you of the four is the acronym EATS. Everybody eats. So escape. I have these little picture like memes for each one. Um, but again, escape. So sometimes kids engage in behavior to avoid or delay a task. So here's a little example. Little boy's whispering, if you're given a task you don't know to, just start crying. They'll send you straight to the thinking chair. It's like a vacation from work. So escape removes undesired situations, tasks, or people. So here are some examples. A child runs away each time the teacher calls him to circle, or a child throws food during lunch so they don't have to eat, right? So some behaviors are pretty clearly for escape. Now, I'm going to talk about this a little bit, that it's one reason we don't do timeouts in our preschool program. Because oftentimes kids engage in behavior because they want to leave the group, they want to leave the activity, they want to get out of the task. So timeout essentially does that, right? It removes them. So one of the reasons we don't use timeout is because it could actually make the behavior happen more frequently. If a child is engaging in a behavior to escape a task, situation, or person, and they successfully do it, they're going to keep engaging in that behavior to get away from whatever they're trying to get away from, right? So Questions to ask if you're not sure if a behavior is maybe to escape something. Um, does the child engage in the behavior when you ask them to do something? Or when a new activity starts? Um, or if you know they don't like something, right? And that thing you present that they don't like is called aversive. If you present that, if they immediately engage in the behavior, right? So let maybe it's broccoli, right? If you were like, oh, we're having here comes dinner plate and broccoli is on it, and you know they hate broccoli, they start crying and run away. That's clearly an escape behavior. They're trying to avoid eating the broccoli. Um, And then does the behavior allow them to leave or delay the activity or not? All right, so we're going to come back to this, but think about that. So, a lot of, like I said, common escape behaviors are like running away, throwing items. A lot of the times, like when kids just have refusal, they just drop to the ground and refuse to do something. Sometimes it's crying and tantruming. The behavior is functioning to escape or delay participation, right, in a task activity, or maybe they're trying to get away from the person. The second function we're going to talk about is attention, right? This is one that we often hear about, right? Um, so as again, a little comic here. Statistically, a drooling is only cute for the first 6 months. After that, we'll have to start screaming in public to get any type of attention. So attention, we look at attention, behaviors that are functioning for attention. It is to gain access to peer or adult interaction. Now, here's the kicker. Sometimes it doesn't have to be positive interaction. So if your kid is engaging in something, um, like um, let's say maybe they're throwing something, or they're banging or making a sound, right? And you are like, stop that, don't do that. Your interaction with them, just saying, stop that, don't do that, that correction actually is functioning to maintain that behavior. Kids don't care if you're giving them attention and it's negative, they just want your attention, right? So you have to really think again about your behavior, your response. So some examples here are crying. Again, think about that infantile response when the babies cry to get picked up. That still happens as kids get older, right? They cry, cry, and cry until the adult comes over and picks them up or gives them attention. Now, I'm not saying don't console your crying children. We console the crying children too. Um, but we want to limit attention when we know certain behaviors are functioning just for this. And then we want to teach, we're going to talk about that, some alternatives to, the crying and whining, right? So that they can get attention appropriately. Sometimes we see behaviors that are to get the peers' attention. So maybe a child swipes or hits at another child because they want the interaction. Now, again, it might not be a positive interaction, but they just don't have the social skills to request the play, the attention, the turn, whatever it might be that they want from the peer, right? So, how do we know? How do we determine if a behavior is for attention? Um, does attention reliably follow the behavior? Does the child look at or approach a peer or caregiver before or even during engaging in the behavior? And this one is the kicker, right? When they start to smile, even before or during the behavior. If they start doing that, it's for attention. And often that triggers us, right? As caregivers, as parents. And we have to learn our best to stay neutral. Because remember, even if the attention is negative, even if you're going to correct them, you're giving them the response that they want, and it will maintain that behavior, right? It's a hard kind of pill to swallow, but we have to think about, um, again, what's happening before and after the behavior to try to break some of these cycles of behavior at home and in school. Okay, tangible is the next one. Sometimes kids engage in behavior to get access to things that they want. right? So this little guy, he's so cute. And it's this little cartoony meme thing says, and then in the middle of the grocery store, I will throw the biggest tantrum that you will have no choice but to give me candy. I swear, grocery stores, Target, like shopping with kids, is tricky, right? Because, and I get it, I totally understand that we don't want to be embarrassed in public. We don't want our kid crying or screaming or pulling at things, right? So oftentimes we give them access to things like tablet, phone, whatever it might be, so that they stop engaging in the behavior. Now, again, um, what does that, what is that? Oh, it doesn't have the little clickies on it. Um, if a kid's crying in the grocery store, right, and you give them your phone, that is giving them access to what they want, right? A tangible item, your phone, right? Following the challenging behavior. So that means every time they go to the grocery store, they're going to cry to get that phone, unless you start switching up your strategy, right? So we'll talk about that. But think about if your child is engaging in behavior to try to get access to things. Um, Sometimes it's pretty clear they're climbing a bookshelf to get that toy they can't reach, or they push another kid down to get access to their toy. Um, think about, does the behavior occur when given the item or activity? Um, does it occur after it's clear they can't not have the item, right? So sometimes we call that in the behavior world denied access, right? Do they get upset when they can't have a certain thing? Does the child ask for the item? Or does the behavior occur when the item isn't presented fast enough? I've seen that before, where a kid's like getting ready for a snack or lunch and they need it right at that moment, right? So they're engaging in behavior because they just want it right away, right? So all of those are kind of indicators that behavior is occurring in order to get access to something. Now, we're going to talk about replacement behaviors and strategies in a moment, but the biggest replacement behavior here is to teach some form of communication, right? So talk to your kids. If they have a speech therapist, talk to them about ways to set up communication systems at home. But an example is if they want certain toys that they can't get, have pictures for those toys that they can point to, right? Or teach them to come to you, right? Tap a parent, ask for help. There are signs for help that they can use to get access to the things that they want. Or sometimes it's setting up contingencies like the scenario at the store, right? What I did with my kids, because they did it just like every other kid, I started setting up scenarios where it's like, listen, like, we're going to be quiet. We're going to keep our hands in the cart when we go in the store. And after 2 minutes, if you're quiet, I'll give you my phone. You're setting up a different contingency, right? You're saying, oh, you want access to this thing that I have? Sure. Show me good behavior, then you can have access, right? So communication and then switching up those contingencies are two strategies for this. Now, the third function we're going to talk about is like sometimes behaviors function just because the function is sensory. So it means that the child likes whatever the sensation is that they're getting from engaging in the behavior. So I have Tigger here. So we have some kids that engage in behavior that's like jumping, right? Or rocking, or maybe some hand flapping, right? All of those could be considered sensory based behavior. So just engaging it because it feels good, right? Um, so these behaviors provide preferred sensory experiences. It's something internal that is pleasing. Or sometimes they gain these behaviors to remove sensations that are displeasing. So if they're in pain. So rocking back and forth is an example. Also, some self-injurious behavior falls into this category. And I definitely have seen this where kids that have like sinus headaches or my gosh, like teeth problems, like dental issues, they'll start like hitting their face, right? And it's actually like relieving some pain or pressure. Um, So again, not all of these behaviors are necessarily challenging, like the rocking, the jumping, the what we would sometimes call like self-stimulatory behavior. We don't look at those as challenging behavior, right? That is the child regulating their body. Um, we should be having a one of these group trainings on sensory, and we'll have an occupational therapist here with us, and we'll talk a little bit more about that. But the sensory system is extensive, and kids that have sensory differences really do interpret the world differently than we do, right? Whereas, like, I'm sitting in this chair, right, and I can feel my bottom in my chair, I can feel my back being supported. Some kids just don't have those same sensations. They don't feel themselves as grounded as others do. Some kids need to move or need to rock to give themselves the input that their body needs to remain calm and regulated. So we don't always intervene because some of those behaviors are good, right? That they're regulating their bodies that way. But when it becomes behavior that is self-injurious, the kid's getting hurt, then we definitely would want to intervene. So if you're not sure if a behavior is um, one that is child's engaging in to access this sort of um, input, think about these questions. Would the child engage in the behavior if no one's around? Okay. Does the child appear to be attempting to avoid a type of input? Because sometimes kids are also like avoidant of touching certain things if they're messy or wet, right? You might see some avoidance behavior as well. Does the child appear to engage in behavior because they need sensory input, right? Or do they appear to be enjoying the behavior and not aware of the people around them? Okay, so let's go back to Angelo. What do we think was the function of Angelo's behavior? Anyone can put it in the chat or unmute. Now, if you remember Angelo, he was fussing at dinner. Um, and remember, the antecedent was mom set the expectation. The behavior was a kind of whole tantrum scenario. And then it ended up where mom sent him to his room. Any ideas of what the function of Angelo's behavior would be? So I'm going to give you the answer. It was probably for escape, right? It really seems like he was kept leaving the table and coming back, leaving, coming back. Didn't kind of seem like he didn't want to be there to begin with, right? And then what happened? Ultimately, he went to his room. So he got to escape dinner time, right? So if the behavior is followed by a consequence that the child wants or desires, that behavior is going to continue to happen. Right. So Angelo's mom is going to need to rethink some strategies to help Angelo without doing like a timeout to his room, because that's essentially going to reinforce this behavior of like, okay, I'm just going to leave every time I come, every time it's dinner time. Right. Um, and I don't think, yeah, before we get to the side, I don't think I have strategies specific to Angelo later on. So I want to talk about it a little bit now, because when we have these type of escape behaviors, we have to really think about how can we engage our kids, help them to participate or engage in the activity we want them to. If they are leaving an area, if they're leaving dinner at the table, if they're leaving at school circle time, if, you know, they are escaping maybe cleanup, right? Like, how can we make that activity more engaging for them? Right. So I had a child who had this similar behaviors at home, dinner time refusal, and mom um, got him his own little table. Right. So it wasn't her table, dinner table. It was at his own little table, and it was kind of like to the side, and she let him have a little toy on it. And he sat at his table and had dinner, and mom sat at hers. And then eventually, mom started moving the table closer and closer to her table, and then eventually he sat with her. So there are ways to um, think about like what does our kid need right now? How can we meet them where they're at right now and work towards a behavior that we think is more expected or appropriate, right? Clean up, right? And what kid wants to clean up, right? But maybe put on a cleanup song, make it fun, make it a game, right? If you can make the activity, the transition more engaging, kids will be less likely to want to escape those activities. All right. So we're going to talk a little bit about our response. So, again, like I said before, the one thing that we can change is how we respond to the challenging behaviors. So, we want to be aware of when and how we respond to our kids. We need to pause and reflect on, like, okay, do I respond the same way every time when this behavior occurs? Um, did I expect this to happen? Like, was it something that I kind of like saw coming? Um, when does my response change? And how am I feeling in those moments? Okay. Because we talk about this a lot, but like a dysregulated adult can't regulate a child, right? So you have to really focus on how to regulate your feelings so that you're calm and neutral to properly engage with a child when they're upset. And then we have to really try to identify what is the behavior trying to communicate? What are they looking for? What is the function of their behavior? So you think you know the function, now what? Right? So we look at this ABC model and we think about what can we do? We want to always try to predict and prevent. Here it is, Benjamin Franklin, whenever we can. So an ounce of prevention is worth a pound of cure, right? So we really want to try to predict and prevent behaviors when possible. There's lots of strategies we use for this at school, but a big one is choice, right? So whenever you can, provide a child choice, right? It often limits the demand, right? So kids often want control. And when we place demands upon them or requests upon them, they often refuse, right? So can we use a choice? So instead of saying, oh, it's time for dinner, come sit. Oh, do you want to sit next to mommy or daddy tonight at dinner? Right? Do you want to sit in the big boy chair or your high chair? Um, so you can provide choices for anything. Um, and they should represent options of desirable activities or materials, even for like food choices, right? If your kid is picky with eating, it's a whole nother training, but providing a choice might be helpful, right? Like I just my kids go, do we want broccoli or green beans for dinner? Right? Either way, we're having a green vegetable, but you get to pick which one. So oftentimes choice can be a great strategy. Redirection. Another big strategy that we use all the time at school. So we want to guide a child's behavior from inappropriate to something that's more appropriate. We always want to do this using a minimal attention without a lot of talking and like very neutral. We're just going to focus on stating what the child should or could do that's acceptable, right? So, an example is if it's time to clean up and a kid's throwing blocks, we can redirect by saying, oh, we're going to put the blocks in the bin. Simple, right? We're just stating what they should do instead that is acceptable. Instead of saying, don't throw, stop throwing. Oh, we're going to put the blocks in the bin. You can look, mommy or daddy's putting the blocks in the bin. Oh, it's my turn. Now it's your turn to put the blocks in. Okay. So we want to, again, not a lot of language and discussion, staying neutral, focusing on what they should do instead. Um, Oh, look, I took my own example here. But here's another one. If a child takes a kid's sibling's toy at home, right? And we do this all the time. Like if I see a kid go over to take another kid's toy, I'll prompt that kid who's about to grab, say, oh, say, I want a turn or my turn. This is like the sign for my turn. So even if I don't have a language, they can just go like this, right? So, and then you can prompt the other child or the sibling, right? to say, okay, like let's give your brother sister a turn, or sometimes I'll say, okay, stay one more minute. Because sometimes kids it's hard to like give up a toy right away. So sometimes say one more minute, right? Or put the finger up for one more minute, and then the kid has to wait, right, to take their turn. So there are two examples of redirection. Oh, look at that. A little more examples. You can trade a toy. Or let's build the block. Another example, instead of like if you're not cleaning up, you can say, oh, let's build a tower, right? You're gonna give them, you're gonna redirect them to a behavior that is appropriate for that time being. You want to always think about replacement behaviors as new skills, right? So first, problem behavior gives the kid access to what they want. What the kid wants is their reinforcement, right? So at first, here's an example. Tantrum got them access to iPad. Okay. So what we want to do is remove that access. So no, Tantrum is not going to get access to iPad anymore, but appropriate behavior. So quiet mouth, hands in cart at the store, that gets you access to iPad, or cleaning up toys, or eating dinner, whatever the appropriate replacement is, that gets access to what they want, right? So think about that. Think about how to replace, right, some of those challenges with appropriate behavior, and then they can get the good stuff for that. So this is a strategy for adults. When I feel stress and a behavior pushes my buttons, I will try. That's all you can do. So T is take a deep breath. Remember we talked about regulation. The nervous system regulation is so important. And it really does help taking a deep breath, taking a moment to just like pause from what's happening can actually regulate your nervous system in your body so that you can make more of rational decisions about your response to how you want to engage with your child, right? So just try, take a deep breath, think about how your kid's feeling, right? And think about the meaning of their behavior. What is this trying to convey? And then why think you got this, right? You can be calm and support your kid. So look at that cute little guy. You got this. So I gave you guys a lot of information, and I just want to share, like, just take one thing at a time. Here's the resources. I'll send you guys the slides, but it is just important to start thinking about. I'm going to stop sharing if I can figure out how to do that. Um, Start thinking about the meaning behind your children or child's behavior, right? That's the place to start. And then think about your responses and how you can modify your responses and your strategies to help them to engage in more appropriate behavior. So, thank you guys for coming on with me today. I am going to stop recording.